The goal of diabetes management is an optimal level of control of your blood sugars. However, day-to-day fluctuations in glucose levels are often unavoidable, and most people living with type 1 diabetes will find they experience hyperglycemia or high blood sugar at varying times throughout the day. Optimal glucose control is typically obtained by maintaining blood sugars on average between 100 to 150 milligrams per deciliter. As the blood sugar increases beyond 150, so does the risk of both acute and long-term complications. Hyperglycemia is caused by an imbalance between blood sugar levels and the amount of insulin. The primary job of insulin is to lower blood sugars. Therefore, not enough insulin or too many carbohydrates will cause high blood sugars. It is important to keep in mind, however, that other factors can also contribute to hyperglycemia. These factors are usually beyond your control and include type and duration of exercise, illness, stress, dehydration, puberty, menstruation, being in the honeymoon phase, and even weather, climate, and altitude. Those factors make it common to have occasional fluctuations in your blood sugar. The individual living with diabetes, along with the care team, should focus on patterns of abnormal blood sugars, usually of at least 3 days' duration. If more than 3 days of hyper or hypoglycemia are occurring in a pattern, changes in the insulin regimen are usually required. Hyperglycemia may or may not be recognized depending on the individual. Initial signs and symptoms of high blood sugar include increased thirst, dry mouth, frequent urination, and changes in mood or behavior. Intermediate signs of prolonged hyperglycemia include blurry vision, along with increased hunger and fatigue. Persistent symptoms of long-standing hyperglycemia include weight loss, fruity breath, feeling significantly lethargic, nausea, vomiting, and abdominal pain. If you experience high blood sugar, it is important to address the situation as soon as it's recognized. A high blood sugar that is not addressed may eventually lead to a serious condition known as diabetic ketoacidosis, or DKA. High blood sugar can be caused by not enough insulin, too many carbohydrates, checking blood sugar before enough time was given for the insulin to work, or it may be due to one of the factors mentioned before that are beyond your control. Either way, it's a good idea to understand why the blood sugar may be reading high. This could help prevent future episodes of hyperglycemia. Treating a high blood sugar is important. Your diabetes care team has provided you with an insulin regimen that will account for treating hyperglycemia. DKA is a dangerous condition which could be fatal. Now, hyperglycemia does not immediately lead to DKA. There is an intermediate step known as ketosis, which, if recognized and treated quickly, can prevent DKA. Ketosis develops when there's an insulin to blood sugar level imbalance. When the supply of insulin is too low to sufficiently help the body's cells use the blood glucose for fuel, the body believes that it is starving. As a result, the body resorts to an alternate fuel source known as ketones, which are produced when fat is broken down. Eventually, the ketones build up and turn the blood acidotic. At that point, DKA has developed. The process is explained in the name itself. Diabetic, meaning hyperglycemia, keto, ketones, acidosis, or blood turning acidic. Once DKA has developed, the only appropriate management is hospitalization with IV insulin. Due to the severity of DKA, it is crucial to monitor for ketones when appropriate. Ketones can easily be tested in the urine or with blood ketone meters at home. When ketones are present, it means the body is breaking down fat for an alternative fuel, since it's unable to get the blood sugar into the cells. Ketones usually cause abdominal pain, nausea, or vomiting, but it is important to know that you may have ketones without symptoms. If ketones are detected, trace or small ketones are usually treatable with significant amounts of extra water, usually several glasses. A sugary drink is not an acceptable alternative and will likely make the situation worse. Extra insulin is often required to reverse the ketones and high blood sugar. You will be guided on the steps to take to reverse this process. Your diabetes care team can provide you with a guideline for providing additional insulin when ketones are elevated. If ketones are moderate or large, you could also contact our pediatric endocrinology team, either the diabetic nurse during the day or the pediatric endocrinologist on call at night, on weekends and holidays. Blood sugar and ketones will be checked every 2 hours until the ketones are gone and blood sugar is back to normal. Ketones should be checked for the following reasons: a blood sugar over 300 milligrams per deciliter, during illness, or a missed insulin dose. It is important to remember to check for ketones even if the blood sugar is normal or low, if there is abdominal pain, nausea, vomiting, or simply not feeling well.